Hair restoration. Hair restoration is a medical procedure that involves restoring hair growth on areas of the scalp where hair loss or thinning has occurred. Hair restoration can be achieved through various methods, including medications, non-surgical treatments, and surgical procedures. Medications for hair restoration include minoxidil and finasteride. Minoxidil is a topical medication that is applied to the scalp to promote hair growth. Finasteride is an oral medication that helps to prevent the conversion of testosterone to dihydrotestosterone, DHT, a hormone that can cause hair loss. Non-surgical treatments for hair restoration include low-level laser therapy, platelet-rich plasma, PRP, therapy, and microneedling. Low-level laser therapy uses light energy to stimulate hair growth, while PRP therapy involves injecting the patient's own blood plasma into the scalp to promote hair growth. Microneedling is a technique that involves using a device with small needles to create tiny punctures in the skin, which can help to stimulate hair growth. Surgical procedures for hair restoration include hair transplant surgery and scalp reduction surgery. Hair transplant surgery involves taking hair from a donor area on the patient's scalp and transplanting it to the area where hair loss has occurred. Scalp reduction surgery involves removing a section of bald scalp and stretching the remaining skin to cover the area. It is important to consult with a qualified medical professional to determine the best hair restoration treatment plan for your individual needs and goals. Anagen phase. The anagen phase is the active growth phase of the hair follicle. During this phase, the hair shaft grows longer as new hair cells are produced at the base of the follicle and pushed upward. The anagen phase is the longest phase of the hair growth cycle, lasting anywhere from 2 to 7 years depending on the individual. The length of the anagen phase determines the maximum length of the hair shaft, as hair growth stops when the anagen phase ends and the catagen phase begins. Factors that can affect the length of the anagen phase include genetics, age, hormonal changes, nutrition, and environmental factors. The anagen phase is an important phase for hair restoration procedures such as hair transplant surgery, as it is during this phase that the hair follicles are actively producing new hair cells. Hair transplant surgery involves harvesting hair follicles from a donor area on the patient's scalp and transplanting them to the area where hair loss has occurred. By selecting hair follicles in the anagen phase, the transplanted hairs are more likely to continue growing and producing hair. Catagen phase. The catagen phase is a transitional phase in the hair growth cycle that follows the anagen phase. During the catagen phase, the hair follicle transitions from the active growth phase to a resting phase. This phase lasts for approximately 2 to 3 weeks. The catagen phase is characterized by a decrease in the production of new hair cells at the base of the hair follicle. The hair shaft separates from the hair follicle and the lower portion of the follicle shrinks. This results in a club-shaped structure at the base of the hair shaft, which is known as the club hair. At the end of the catagen phase, the hair follicle enters the telogen phase, which is a resting phase that lasts for approximately 3 months. During this phase, the hair follicle is inactive and the hair shaft remains in place until it is shed or falls out. While the catagen phase is a natural part of the hair growth cycle, it can be disrupted by various factors such as stress, illness, hormonal changes, and certain medications. This can lead to increased hair shedding and may contribute to hair loss or thinning. Telogen phase. The telogen phase is the final phase of the hair growth cycle. During this phase, the hair follicle is in a resting state and no new hair growth occurs. This phase lasts for approximately 3 months, although the duration can vary depending on the individual. The telogen phase is characterized by the club hair, which is the hair shaft that has detached from the hair follicle during the catagen phase. The club hair remains in the follicle during the telogen phase until it is shed or falls out, and a new hair shaft begins to grow during the next anagen phase. It is normal to shed some hair during the telogen phase, with an average person shedding 50 to 100 hairs per day. However, disruptions to the hair growth cycle, such as stress, illness, hormonal changes, and certain medications, can cause an increase in hair shedding or premature entry into the telogen phase. This can lead to temporary hair loss or thinning. Understanding the hair growth cycle and the phases of hair growth is important for hair restoration procedures such as hair transplant surgery, as it can help to determine the optimal timing for the procedure and the selection of hair follicles in the anagen phase for transplantation. Timeline. The hair growth cycle is a continuous process that can be divided into 3 phases: anagen, catagen, and telogen. The duration of each phase and the overall hair growth cycle can vary depending on factors such as age, genetics, and health. Here is a general timeline of the hair growth cycle. Anagen phase. This is the active growth phase of the hair follicle. It lasts for approximately 2 to 7 years, depending on the individual and the location of the hair on the body. Catagen phase. This is a transitional phase that lasts for approximately 2 to 3 weeks. During this phase, the hair follicle transitions from the active growth phase to a resting phase. Telogen phase. This is the resting phase of the hair growth cycle. It lasts for approximately 3 months, during which the hair follicle is inactive and no new hair growth occurs. After the telogen phase, the hair follicle re-enters the anagen phase, and the cycle begins again. The duration of the entire hair growth cycle can range from a few months to several years, depending on the individual. Understanding the hair growth cycle and the phases of hair growth is important for hair restoration procedures such as hair transplant surgery, as it can help to determine the optimal timing for the procedure and the selection of hair follicles in the anagen phase for transplantation.